So when we speak about reflux disease, it's important to understand the actual anatomy and the physiology. The esophagus is a food pipe that goes from the top down through the diaphragm into the abdomen to meet with the stomach. In the diaphragm, there's an opening called a hiatus through which the esophagus comes through. In some patients, in addition to their reflux or valve problem, they may also have a hiatus that is larger. We refer to that as a hiatal hernia. So part of the management in the surgical standpoint is managing the hiatus as well as the anti-reflux portion. When we talk about an anti-reflux procedure, there's several things out there that people are familiar with. Historically, Dr. Nissin performed what's called a Nissin Fundoplication. A fundoplication is the actual wrapping of the stomach around itself, around the esophagus, to create a valve effect. And so for the longest, that was what most general surgeons did. One of the consequences of the Nissin fundoplication is not being able to swallow or not being able to burp. And so long term, people had more problems from the procedure than the relief that they expected to get. The second half of that is that that particular procedure has a life expectancy of about 5 years. So at that point, things relax enough that sometimes patients have a recurrence of their symptoms. There are various forms of fundoplications. A 360-degree wrap, it's called a Nissin. A 270-degree, where they take the stomach and move almost completely around, is called a toupee. There's a partial anterior fundoplication, which is called a door, and those are all performed from the abdomen. If your repair or the fundoplication is performed through the chest, that's called a heel fundoplication. The transoral incisionless fundoplication is relatively new. It's been on the market, and it's gained popularity because of its minimally invasive approach. Using an endoscopic procedure, we look inside the stomach with the camera, with the light. The instrument itself is around the camera and allowed to turn back on itself to recreate the valve mechanism inside without having to make an incision in the stomach. The advantage is that you have the flexibility and the malleability, be able to change that portion of the stomach and really recreate that valve, that physiologic valve mechanism. And the best part is it's minimally invasive, you return to normal function quicker, and it's really more of a 270 degree, and so the unwanted side effects of not being able to swallow or not being able to burp or having that sensation are avoided.